Did you know that ADHD, or Attention Deficit Hyperactivity Disorder, affects 5 to 12% of school-age children, and its prevalence in boys is 4 times higher than in girls? Yes, it's a common condition, but often misunderstood. ADHD is not a reflection of a child's intelligence or their potential. It's a medical condition that requires understanding and management. It's also important to note that girls and boys may experience ADHD differently. While boys often exhibit impulsive and hyperactive symptoms, girls tend to display inattentive or distractible symptoms. This difference in symptom presentation can sometimes lead to girls being underdiagnosed. So, what causes ADHD? While the exact cause remains unknown, research suggests a combination of factors. These include genetic influences, particularly dopamine candidate genes, and a neuroanatomical hypothesis involving the catecholamine system. Cognitive factors, such as developmental disabilities and errors in executive function like inhibitory control, also play a role. And lastly, alterations in the sensory system filters, which influence arousal, are considered contributory. Diagnosing ADHD involves observing a child for symptoms that persist for more than 6 months, with onset before the age of 7. These symptoms must be present in at least 2 settings such as home, school, or work, and significantly interfere with academic, family, and social functioning. ADHD is divided into 3 subtypes: combined type, predominantly inattentive type, and predominantly hyperactive-impulsive type. Each subtype is characterized by a distinct set of symptoms. In summary, ADHD is a complex disorder with diverse manifestations and causes. It's not just about being hyperactive or inattentive. It's a condition that impacts every aspect of a child's life, from school performance to social interactions. It's important to remember that ADHD is not a reflection of a child's intelligence or potential. It's a medical condition that requires understanding and management. So, what causes ADHD? The answer is not as straightforward as you might think. Let's start with genetics. Research has pointed towards the role of dopamine candidate genes in the development of ADHD. Dopamine, a neurotransmitter, plays a significant role in our ability to focus, plan, and execute tasks. Certain genetic variations can lead to differences in how dopamine functions in the brain, potentially contributing to ADHD. Now let's talk about the cognitive perspective. ADHD is often associated with developmental disabilities and errors in executive function, such as inhibitory control. Executive function encompasses a range of cognitive processes that allow us to plan, focus, remember instructions, and juggle multiple tasks successfully. When these processes are impaired, symptoms of ADHD can emerge. Moving on to arousal theories, these suggest alterations in the sensory system filters as a potential cause of ADHD. Essentially, this means that people with ADHD may process sensory information differently, leading to difficulties in focusing and controlling impulses. But it's not just about what's happening inside the body. Our environment also plays a part. Exposure to certain toxins such as lead, alcohol, during fetal development, and even traumatic life events can contribute to the development of ADHD. For example, fetal alcohol syndrome and Fragile X syndrome are congenital problems that have been associated with ADHD. Even conditions like thyroid disorders and atopic conditions, that's allergies and eczema to you and me, can mimic symptoms of ADHD, complicating diagnosis. Despite the complexity of its causes, understanding these factors can help in managing and treating ADHD. Remember, knowledge is power. By unraveling the causes of ADHD, we can better understand how to support those living with this condition. And that's what it's all about, isn't it? Providing the best care and support to ensure everyone has the opportunity to thrive. So, what causes ADHD? The answer is not as straightforward as you might think. But isn't it fascinating to peel back the layers and delve into the complexity of the human mind? Despite the complexity of its causes, understanding these factors can help in managing and treating ADHD. Identifying ADHD is not always easy. It requires careful observation and understanding of the child's behavior. The diagnosis of ADHD includes 3 subtypes: the combined type, predominantly inattentive type, and predominantly hyperactive-impulsive type. For a child to be diagnosed with the combined type, they must show 6 or more symptoms of inattention and 6 or more symptoms of hyperactivity-impulsivity. The predominantly inattentive type diagnosis is given when a child shows 6 or more symptoms of inattention, while the predominantly hyperactive-impulsive type is diagnosed when a child presents 6 or more symptoms of hyperactivity-impulsivity. Symptoms must persist for more than 6 months, with an onset before age 7. It's also vital that symptoms are present in at least 2 settings, such as home, school, or work, and that they interfere with academic, family, and social functioning. Core symptoms of ADHD include inattention, hyperactivity, and impulsivity. A child might make careless mistakes, fail to complete tasks, or be forgetful. Hyperactivity can manifest as fidgeting, talking excessively, or having difficulty staying seated. Impulsivity might appear as blurting out answers before questions are completed, or having trouble waiting their turn. It's important to remember that these symptoms could also be due to other conditions, such as learning disorders, hearing or visual defects, or even traumatic life events. So, ruling out other causes is crucial in the diagnostic process. Early diagnosis and intervention can make a significant difference in a child's life. ADHD is a lifelong condition, but that doesn't mean it cannot be managed effectively. The treatment of ADHD is as complex as the disorder itself, often requiring a multimodal approach. Let's delve into these treatment options. Non-pharmacological interventions are an important part of managing ADHD. These include strategies like parent management training, where parents learn effective ways to respond to ADHD behaviors. Anger control strategies can help children with ADHD manage their emotions, while positive reinforcement can encourage desired behaviors. Social skills training, individual and family therapy, resource room access, tutoring, classroom intervention, exercise routines, and extracurricular activities can all play a role in managing ADHD. Now let's shift gears to pharmacological treatments. The standard treatment for ADHD typically involves stimulants, such as methylphenidates like Ritalin and Concerta, or amphetamines like dextroamphetamine and Adderall. Non-stimulant options like the SNRI atomoxetine, also known as Strattera, can also be used. Remember, there is no one-size-fits-all treatment for ADHD. Each individual is unique and may respond differently to various treatment strategies. It often takes a combination of approaches, tailored to the individual's needs to effectively manage ADHD. With the right support, individuals with ADHD can lead successful, fulfilling lives. And that's what we all want, isn't it? To lead a life that is not defined by diagnosis, but empowered by understanding, acceptance, and the right support. Alright, that's it for our deep dive into ADHD. We hope you found this information helpful and enlightening. But remember, our journey doesn't end here. The world of health and medicine is vast and constantly evolving, and we're here to guide you through it. So if you haven't already, please hit the subscribe button now to join our Medicine Health 360 community. By subscribing, you'll be the first to receive our latest videos, packed full of crucial, up-to-date, and systematic medical and health knowledge, all presented in an easy-to-understand way. If you found this video on ADHD informative and insightful, please give us a thumbs up. Your likes encourage us to continue developing high-quality content that can help everyone towards better health and a better life. Our channel is brimming with other videos that tackle a wide range of health topics. From understanding mental health conditions to decoding the mysteries of the human body, we've got you covered. Make sure to check them out. We also value your thoughts and opinions. If you have any questions, suggestions, or personal experiences you're comfortable sharing, feel free to drop them in the comments section below. Your input not only helps us improve, but it also fosters a supportive community where we can learn from each other's experiences. Thank you so much for watching. Here's to better health and a better life.